Protocol.
All right, ready to roll? Good afternoon, everyone. I'm Mayor Jenny Durkin, and I want to welcome the U.S. Army and General Cherry to Seattle. 29 days ago, only 29 days ago, the first case of COVID-19 was confirmed in King County. Our city, our region, and our country have been transformed since that day. We have working really hard to take the measures in Seattle and King County and our state to save lives and to protect our healthcare system. I want to thank all the people who are with us here today, all the elected officials who've been working so hard together, our governor, our county executive, Dow Constantine, our federal delegation, including Congresswoman Pramila Jayapal, who you hear from. All of our congressional delegation has been working really hard together. U.S. Senators Patty Murray and Maria Cantwell. We all know we're in this together, and while all of us get tired at different times, we make sure that on those critical issues we will come together to do what we need to do to save lives here in Seattle and protect our workers. We have come together as a community because we know the only way to really protect those frontline healthcare workers and our first responders is to flatten the rise of the virus, flatten that curve, as you've heard everyone saying. And the only thing we can do to do that is to create distance between ourselves. It is so contrary to who we are as human beings to create that distance and to stay home. I know that because we took our measures quickly, we were able to have some capacity in our hospitals we would not have had otherwise. We learned on a Friday night, and by the beginning of the next week, we were already having our largest employers work from home, the City of Seattle work from home, and our researchers and scientists and public health officials working together to give their elected leaders the information they needed to make choices. Our first responders and healthcare workers have done everything they can to respond to COVID-19. And what they've done is nothing short of heroic. They are fighting hard for all of us. And if you want to help your nurses and doctors, stay home and keep your distance. If you want to help your first responders and the Army people who are here today, please stay home and keep your distance. Because we are at the start of a marathon. This is not a sprint. It is going to take time for us to get through this. We know it's so hard, and we know that this has had great impacts on everyone in this region and throughout our country. A month ago, Seattle was one of the fastest growing cities in America with a booming economy. We had more cranes and construction than almost any city in America. And today, it's all shut down to fight this virus. And that has had huge impacts on our workers and our small businesses and those communities that are more displaced already. It's why we as a city worked so hard at the beginning to try to build resilience there, to get grocery vouchers in the people's hands that needed it, to get daycare for our healthcare workers, to make sure our small businesses had some resiliency. And I want to really thank Congresswoman Jayapal, because we could not have done that and gotten what we needed for this region without having her as a fierce advocate for our city and for our region. And for our whole congressional delegation, Patty Murray and Maria Cantwell have been on the phone relentlessly seeing what we need. We know that this Army Field Hospital is going to be critical to the response here in Seattle. It will reduce the burden on our hospitals here. We'll work quickly with the Department of Defense and others to make sure that we can get this set up. I want to thank FEMA for all the work they've done to respond as quickly as they had to get this in place. I very much appreciate the advocacy of our Governor, Jay Inslee, who has been a tireless advocate for the public health and the public good throughout this. I'd like to thank the quick work by the Seattle Seahawks, by CenturyLink Field and others to make sure that we could get this up and sited quickly. I want to welcome every one of the soldiers here who are going to be helping us. They're here to help. We had a lot of rumors about was the military taking over Seattle. The answer is no. They're here to help, and they're here to help because they know Seattle needs it. I really want to extend my greatest and deepest gratitude to the 300 men and women joining us from the 627th Army Hospital Wing from Fort Carson. They're going to be here doing life-saving work. They'll be living and working in our community throughout this. Welcome them if you see them. Welcome to Seattle, soldiers. We're glad you're here. We appreciate your work. We will come through this. We will come through this because we've come together as a community, and each of us can and must do our part. It's already been hard on so many people, and I know it is only going to get harder. Many of us have been touched by people who've gotten the virus, and many have been touched by people who've lost their lives. We need to prevent that, and the only way we do that is for people to obey the governor's order to stay home, stay healthy, to follow the directives that Dow Constantine, our county executive, and the public health system would get. And through it all, let's remember, as tired as we get, as passionate as we get, we're in it together, and we must let our kindness and our deep sense of love and respect for each other prevail. Thank you very much, and with that, I'll give you a person who's been just a terrific partner throughout this process, County Executive Dow Constantine.
Thank you, Mayor Durkin. In addition to those we've mentioned this morning, I also wanted to welcome a member of Congress from East, whose district includes East King County, Dr. Kim Schreier. Congresswoman Schreier, you better get out quick after the press conference, or we may press you into action here serving our patients and residents. I am honored to be here today. My own father, I was just remembering as the mayor was speaking, served 2 years in an Army medical unit in Korea before the real heavy fighting began. I am honored by the presence of these soldiers from the 627th Army Hospital Center at Fort Collins. And I was reminded, too, that it was just a month ago. It was 1 month ago tonight that I got the phone call. And they told me that there was a cluster of illnesses at a nursing home in Kirkland here in King County, and that they had determined that it was coronavirus, the first known concentrated outbreak in the United States. I hurried back to my Washington, D.C. hotel room where I'd been preparing for a speech to a National Counties organization about early childhood development and the aid we can provide to families with infants and toddlers. And I got on the line to Alaska Airlines and made reservations for the next flight out. From that moment until now has really in many ways been a blur. It has been an absolute sprint as we've asked people to take extraordinary actions, and this community, Mayor Durkin, Governor Inslee, has responded magnificently, turning daily life upside down in a bid to flatten this looming curve of infection. I know people are anxious, seeing weeks pass without a paycheck, seeing the days go by without kids getting to see their best friends or their favorite teachers, the shops and the gathering spots that make our communities so vibrant, empty, imperiled. But this is what we have to do to save lives and to get over to the other side of this pandemic. Our public health message is vital and it is consistent. Stay home. When you can't stay home, keep your physical distance. And always wash your hands and never touch your face. We are pulling out all the stops to accomplish this key thing, to keep our hospitals from being overwhelmed, to keep them functioning as, even with our strong and early mitigation efforts, we brace for a wave of patients coming in needing acute care. King County is setting up assessment and recovery facilities in Bellevue and in Shoreline, quarantine and isolation sites in Kent and in Issaquah, both in Seattle, along with additional space to help de-intensify homeless shelters and reduce the chance of infection, and all of it in a bid to keep the limited supply of hospital beds and equipment available for those who need acute care. So we warmly welcome the addition of this facility, a facility for non-COVID cases, so that those hospital beds around our region can be kept available for people who are struggling with COVID-19. And at the same time, as we add these 148 beds, recognize that just our preliminary numbers from just last night in King County add another 178 confirmed cases of infection with the novel coronavirus. We simply must do more right now across all governments to protect the people who call this special place home. This is a crisis unlike any other we've faced, and it deserves a response unlike any other. Thank you to FEMA District 10 Administrator Mike O'Hare. Thank you to Brigadier General Doug Cherry. And thank you to the personnel of the 627th Army Hospital Center based at Fort Collins, Colorado. You join here a community that is united and is determined, ready to do its part to get us through this together, every one of us. Thank you, and it is my honor to introduce someone who has really shown magnificent leadership during this moment of crisis, the Governor of the State of Washington, Jay Inslee.
Good afternoon. This we know, the day is going to come again when we root for the Seahawks at CenturyLink Field. The day is going to come when we root for the Sounders in this field. But today we're here to thank the 627th from Fort Carson, Colorado. What they're doing for the state of Washington is going to be and has already given us a magnificent feat of giving us confidence. And I want to thank everybody who's pulling together behind them. Dow Constantine's did a great job. The mayor particularly to stand this up so quickly, and your staff to get this. It's really great. Thank you for what you've done. I have 5 quick points. Number 1, this facility is a non-COVID-19 facility. It's going to treat people who do not have COVID-19. But it is every bit as heroic in this effort, because every single person that the 627th treats is going to free up a bed for those people who do have COVID-19 in our other facility. Number 2, this is starting in Seattle, but this capability is going to grow statewide. We need additional hospital beds, additional ICU beds, additional ventilators across the state of Washington. We know, unfortunately, that this epidemic is going to grow to the furthest corners of the state of Washington. And we have to be and are committed to building that hospital and associated capacity in every single part of the state, because we know that it will be needed. And we have a good team working on that every single hour. Third, we know this. This is a tremendous step by the federal government. We're so appreciative of FEMA, appreciative of the Army Corps of Engineers, appreciative of folks who've been pulling together in multiple government levels. But we have to realize this is not enough. We do need more assistance in hospital beds and, importantly, medical personnel from the federal government. So we are in continued talks with the federal government in the fervent hopes that they will bring more medical capacity to our state. It is absolutely needed. And the place with the first outbreak in the United States ought to be on the top priority of the federal government, and we look forward to further deployment of hospital and medical personnel working with our federal partners. Fourth, I want to mention the Army Corps of Engineers. They're not here today, but they have committed to helping build what you call associated facilities, and they are going to be building these for us for isolation wards that have less acuity needs, so we can help get people into isolation, particularly those who are unsheltered folks, to prevent a big outbreak in the homelessness community. The last thing I'll say is that I hope that we see the 627th as the iconic heroes of so many people today. They've left their lives to come here to help us in Washington State. Working with them are the nurses, the respiratory therapists, the physicians, the maintenance crew at the hospitals who are exposing themselves to risk. They are heroes, but they're not the only heroes. Here's the point I want to make. You can be part of the 627th if you don't make that unnecessary trip to the grocery store that creates unnecessary risk of transmission. You can be part of the 627th if you don't make that trip to see your grandparents that might expose them to this virus. You can be part of the 627th if you're a business owner and you honor the order, which is the law of the state of Washington, not to be open for on-site business, which is both the law and just common good sense. So we are hopeful we're all part of the 627th, and if you have any questions about that, ask Lieutenant Colonel Jason Hughes, who's here today. He's from Montesano, and he'll set you straight. Good luck. Wash your hands.
And we'll next hear from General Cherry.
So good afternoon. I want to start by saying our thoughts are with all those who are affected by the ongoing pandemic. I'm here as NORTHCOM senior leader on the ground to coordinate mission-enhancing military support to FEMA and ensure unity of effort in our whole-of-nation fight against COVID-19 to protect the people of Washington and to prevent the spread of this terrible virus. As a military force, we conduct a wide array of missions around the world, but this mission is different. This is helping our fellow Americans, our friends, our neighbors, our co-workers, our community partners, and our family members. We are all fighting alongside each other in this battle against an unseen enemy. As part of that fight, we have been working diligently with our local, state, and federal partners to bring much-needed medical capabilities to the state of Washington. And today, we are seeing that hard work come into view as this site will soon be transformed from a world-class sports arena into a life-saving, life-sustaining American Army hospital. We have an outstanding group of highly trained, highly capable, and experienced medical professionals who are here to help lift the burden on the local health systems by providing medical care ranging from trauma cases to broken arms. The focus here will not be COVID-19 patients, but instead it will be to provide care to reduce the burden on local hospitals of those patients not infected, allowing local medical professionals to focus on providing much-needed assistance to those who are. I am proud to be here and to be part of this very important life-saving mission, and I'm confident that together, as a nation, with the support of our federal partners and communities, we will defeat COVID-19, and in the weeks and months ahead, we will emerge victorious against this threat. Thank you, and I'll be followed by Administrator O'Hare.
Thank you, Doug. I want to thank Governor Inslee, Executive Constantine, Mayor Durkin, and Brigadier General Doug Cherry for their leadership and partnership and their sustained efforts to flatten the curve. The federal government continues to take aggressive and proactive steps to address the coronavirus pandemic. The health and safety of the American people, and specifically the people of Washington State, are my top priority. My focus remains on supporting Governor Inslee and his team by finding and delivering the resources they need so that local leaders can continue to protect lives, sustain their communities, and flatten the curve. I've told Governor Inslee, Mayor Durkin, and many others in no uncertain terms, if you need something, tell us. It's FEMA's job to facilitate solutions to complex challenges, and we do that through partnerships and coordination with local, state, tribal, and federal agencies. Locally executed, state managed, and federally supported. Waiting until the medical system is overwhelmed before taking decisive action is too late, which is why FEMA has obligated a $100 million mission assignment to the Department of Defense to provide medical services to the state of Washington. This proactive move to bring the U.S. Army's 627th Hospital Center provides options for the state medical system, and it's a vital piece of our regional response. We recognize that our bold action requires a whole-of-community, a whole-of-nation approach that includes harnessing the strength of our private sector partners. And with that, I want to thank CenturyLink and David Young and his team for their partnership and collaboration. I also want to thank so many others in the private sector companies that have reached out to share resources were taking steps on their own to help Washingtonians during this challenging time. We're going to get back to normal, and we're going to succeed as a unified team. One team, one fight. Thank you very much. And I'll be followed by Congresswoman Jayapal.
Thank you so much, Administrator O'Hare, and I want to start by thanking Mayor Durkin, who has done a phenomenal job of standing this up quickly, but not only that, getting immediate help and resources through the city government to people who desperately need it. Thank you, Mayor Durkin, for all of that. I also am grateful to live in a state with a governor and a county executive and other leaders who have invested in a public health system that has been so crucial to the front lines of this. And Governor, I thank you for your early and strong leadership. County executive, thank you for prioritizing even systems that haven't been picked up elsewhere, like our criminal justice system. Deeply appreciate that. Let me thank FEMA, the Emergency Corps, and General Cherry. Thank you so much for, I don't know where you went, but thank you so much for your leadership. We welcome the troops here. I just had a conversation with the General where we were talking about how sometimes people don't get to see the troops in our own backyard helping folks as they need it. And we are a deeply welcoming community here in the state of Washington and certainly in the 7th Congressional District. On behalf of my incredible colleague, Dr. Schreier, Congresswoman Schreier, our senators, and our entire federal delegation, we have been pushing very, very hard to make sure that the federal government uses every tool in its toolbox and actually provides a response that matches the scale of the crisis. And so in this last package that we just passed yesterday, we have $2.3 trillion that will flow from the federal government. We understand that that is not enough, and we are already at work on the next package. But I did want to say that in that package, there is $45 billion of additional aid to FEMA. Again, we know that's not enough, but that is to try to facilitate a quick response to states, localities, territories, and tribal nations across the country as they deal with this crisis. And that does include a medical response, which we are going to be able to have the benefit of here. It also includes another $16 billion for the National Strategic Stockpile, which is so critical for us to get the personal protective equipment to our frontline health workers. And of course, it includes the National Guard deployment and coordination of logistics as needed. To the people that are in the district and across the state that might be watching, we know that this is a time of tremendous anxiety. Our goal as an entire delegation on both sides of the aisle is to actually try to get quick relief to you. And so to that end, let me just highlight 4 provisions that are in the bill that we passed yesterday. Our goal as a delegation is to take that legislative language and figure out what it means for you to be able to get those benefits. How do you get your unemployment assistance? How do you get your cash assistance? How do small businesses get relief? And so in the next coming days, we will work closely with the governor, the mayor, the county executive, and our federal officials to get the answers to those questions. So 4 things I want to mention. First, we significantly expand unemployment insurance, the biggest expansion of unemployment insurance in decades. And we allow for a new pot of money that would cover people who are not traditionally covered by unemployment insurance, and we waive many restrictions that prevented people. Secondly, money directly in the pockets of people. We know this isn't enough, but there is money there for a $1,200 one-time cash payment per adult, depending on your income threshold, and $500 per individual that we hope to get in your pockets as quickly as possible. Third, small businesses. We know you're devastated. That was probably 100 of the calls I got yesterday. How do you access this money quickly? We will work with the SBA and with our banks to make sure that that money is getting distributed quickly. But it is $350 billion of forgivable loans and grants. And the goal here is to try to help with relief, immediate rent, utilities, those kinds of things, but also to try to keep as many people on payroll as possible. And then finally, investments into our strained local and state governments, which are picking up a lot of the costs right now. We know that we have to continue to do more, but we are putting at least $2.9 billion will come to Washington State. We are investing $250 billion into strained healthcare system, and we will continue to try to do as much as we can on this next package that we are already at work at. So I will just end by saying this. I know we talk about social distancing. I prefer the term physical distancing. We are keeping ourselves distant so that we can follow the governor's stay home, stay safe order. However, I would just suggest that perhaps we call it physical distancing and social closening. We are an interconnected community here in the 7th District and across the state, across the country, and the goal now has to be also to pay attention to our connection, to our mental health, and to our physical safety. And finally, thank you to the public health workers, to the first responders, to the bus drivers, the grocery store workers, the people who are continuing to pick up your garbage. Thank you to all those who are unseen but are doing the work that we need to get through this crisis together. Thank you so much, and I think I'll turn it back to the mayor for question and answer.
Yeah, before we take the first, I also want to call out Laurel, who's been heading up for the city, our Emergency Operations Center, and Chief Scoggins, who's been one of our incident commanders. They reflect a huge number of people beneath them who are working tirelessly 24 hours a day. Thank you for all the work that you and your teams are doing. I'd point out that, for example, today we had a fire in South Lake Union, and even though COVID continues, our first responders are still showing up. So we'd be happy to take questions, Governor. I'm sure many of them will be directed to you if you want to come closer to the podium.
Certainly, yes.
So, Governor, we have been watching the President of the United States say not such kind things about you, and even speaking about you disparagingly yesterday, including the Governor of Michigan. How does that square with what is happening here? Are we getting what we would be getting if you and the President were buddies, or are we getting what we would get nonetheless?
Well, I'll share some good news with you. None of us here are being distracted by the background noise that might come out of the White House. Our job is too important to save our constituents and our neighbors and our families from this deadly virus. And I can just tell you good news, it hasn't knocked us off our game at all. Insults aren't going to stop us from working together. And that includes federal agencies like FEMA and the U.S. Department of Health, the Vice President with whom I've had quite a number of really good discussions with. So that's the good news. And I can tell you, one of the reasons is that the people I work with, you think of the governor of Michigan, I know her, I respect her, and I can tell you, she gets up every morning trying to do for her state what I'm trying to do for my state, and she does not expect the Hallmark card every morning saying how much people thank her. She just thinks she's grateful to have her job as a governor, as I am too. And so I have good news for you. We're working together, and people ought to be confident of that. By the way, I forgot to state your question, but
But the President has said that you have not been grateful enough.
well, that's my point. I as an elected official, I take an oath of office, and I don't recall in the oath of office saying, I'll do my job to protect the citizens of Washington State as long as I don't get enough love. That's just not in the oath of office. And I have repeatedly thanked the federal government for what they've done in the state of Washington. A lot of good things have happened here. We've had a lot of personal protection equipment delivered for the state of Washington. You see the Army here today, the U.S. Army Corps of Engineers, the Health Department. A lot of good things are happening in partnership with our federal government. And of course, all of us have gratitude for that. But we also realize there is more to do. We do need more beds for hospitals, and we are asking the federal government and the administration to provide those. And I'm very hopeful that those are forthcoming. As I said, it would also be helpful if the federal government mobilizes the manufacturing base of the United States so that we can use all our incredible manufacturing talent just like we did in World War II. We need the manufacturing base to be mobilized of our nation to make ventilators, to make visors, to make N95 masks. And the only way that's going to get done is if the federal government did what FDR did in 1941, which is to organize the manufacturing base. I had a discussion with the president. I suggested to him that that would be most helpful. In that discussion, he said he would not do that. The next day, he did that. So I'm happy that he followed my advice. I am grateful that he followed my advice. And I hope it will now continue for all of the other things we need to get the manufacturing sector to do. I think that would be a great thing, and I'm hopeful that's under further consideration. Look, we've got to get manufacturers in the game. Some of them are stepping forward. I talked to Dan Nordstrom, CEO of OR, Outdoor Research, who does great mountain climbing equipment. We've used it in my family for years. They are now going to start making masks and gowns. We have other companies that are stepping forward. We have the prison industries in our prison system now starting to make surgical gowns. But it would be helpful if we have the federal government to fully mobilize the manufacturing the base. And really only a president could call us toward that situation. It's just suboptimal if Franklin Delano Roosevelt had said on December 8th, yesterday, Sunday, December 7th, 1941, a day that will live in infamy, and Connecticut, why don't you go build a battleship? It's just not the best way to organize our joint efforts. And listen, this is a bipartisan view. Republican governors share that view across the United States. And by the way, I want to point this out too. We have had a very successful bipartisan effort in the state of Washington. The Republican legislators have voted with Democrats. The leadership of both chambers showed their appreciation for the very difficult order we had to stay home and stay healthy, which was a difficult decision, and they backed us up on that. So there's a lot of good news here about bipartisanship.
Governor of Michigan earlier today said, when I got back from federal government or from vendors with whom we procured contracts, they're being told not to send stuff to Michigan. Is that something that you've heard here? Are you concerned about that as the president interfering?
Yeah, the question was in Michigan, and I have not heard this, but you're telling me that the governor of Michigan said that she has heard from vendors that they're being advised by the president not to supply necessary equipment to Michigan. By the way, I've not heard that, so this is part of your question, not my statement. I hope that is not the case. It would be one of the most grievous insults to democracy and the health of our loved ones that I could possibly imagine. I will expect that the president will not do that, and if there's any scent of that, we are going to call for the entire nation to call him to knock it off if that happens. I don't think it will. I expect it won't. And if it happens, we'll engage the entire nation, including my Republican governors, to say that just is not going to be allowed. Your second question is, by the way, I have not heard any indication of that in the last day and a half from anyone in the state of Washington.
Thank you. We saw your guidance this morning on funeral services, that now funeral services will be allowed at gravesides or in funeral homes when only immediate family members are involved in practicing social distancing. Why did you decide to make that adjustment?
Well, frankly, yeah, thank you, Mayor. I'm barely trainable, so thank you. Listen, we're going to have a lot of changes to these orders as time goes on. This is just one of, I think, and who knows, we'll be flexible throughout this system as we hear from citizens. And what I heard was some, heart-wrenching stories in the last 24 hours of people who'd lost loved ones and just could not stand the thought to not be present there. We had a senator from Yakima, Jim Honeyford, who told me a story that was really heart-wrenching, and that affected our decision. But as you know, there are many, many difficult decisions we're going to have to make, and I do encourage people in all circumstances, limit the number of people who have to go to a funeral. Make sure you use social distancing. We don't need any more funerals in the state of Washington.
Okay,
Just a couple of quick questions. Firstly, there was a study that came out of the University of Washington this week that looked at the projections moving forward, the trajectory, saying that we could have, if we kept all of the current social distancing in place through, I believe, June, we'd have 1,400 deaths here in the state of Washington. Is that informing anything that you're deciding moving forward? Should people be prepared to keep things as they are until that June or July?
Well, the question was, should we be prepared to have what is in place today in June? And the answer is, I believe it is highly likely that some version of the Stay Home, Stay Healthy initiative will need to continue past that initial 2-week period. What that is something that will be judged by that study that you alluded to and probably 24 others. So people need to know that every day we look at multiple data points that come in from the epidemiology labs or analysis. We look at the percentage of positive tests. We look at the hospitalizations for those with COVID-like symptoms. We look at the traffic patterns to determine whether or not people are staying at home as they should. We look at telecommunications traffic to see what is happening. So yes, that is one of the things that we put into the analysis, and that issue is going to continue. I dearly wish that I could tell people the day that COVID-19 will be gone from the state of Washington. But there is one thing I know about that date. The more people bend to this task, the more people consider they're with the 627th from Colorado, the sooner that day will come. And I cannot be more sincere in asking people to really think in their personal lives what they can do to be part of this effort. I had to come up here today on I-5, and frankly, there are way too many cars on I-5 today. I do not believe yet we are doing what we need to do. So the more people will do voluntarily, the less we will have to do from orders. So I hope people work together.
One last question. There's growing calls for a rent freeze while the duration of this plays out in the outbreak, as well as mortgage forbearance. Is that anything that you're considering?
Well, yes. The question was about evictions and mortgage forbearance. We've done the evictions. We will continue to consider other measures.
I need to ask more on that. So you have not then come up with a policy saying people should not be evicted and that there should be forbearance for their mortgage?
I believe we have. And so if that is incorrect, I will get some information to you. The question was about evictions, and so I'll get the latest information to you.
I'd like to ask another question, Governor, about this space. Oh, okay, that's fine.
I'll get back to you.
Okay, I can do that.
We're going to go to the phone. The first question is for Amy Moreno.
Governor, Amy Moreno, King 5 News. President Trump has talked about quarantining some hotspots and cutting off travel. He mentioned more specifically New York, which Governor Cuomo seemed to balk at. How would you feel about quarantining Washington as a hotspot? And Governor Cuomo seemed to think it wasn't really enforceable. How would you feel about that? Have you had any discussions with the president about that?
The question was, have we had any discussions about quarantining the state or parts of the state? The answer is we have not. But let me just say at the outset, we should be making these decisions about our travel decisions today. We don't need any political leader. I'm just calling on fathers and mothers and young people to make their own decisions, which means we need to reduce travel dramatically in the next several days. That's the first thing I will say. But in answer to your specific question, we have not had discussions with the White House nor internally about the possibility of that. But as I have said and will quite a number of times, these are decisions made on the what will happen in the future, which we cannot predict. And we will make decisions to be as confident as we can that we can save the people we love. And that's what we're doing today.
Next question is for Deborah Wong, KOW.
KOW, are you there? Did you mute yourself? Okay, well, let's go to the next one.
All right, next question is for Sarah Sidner. CNN. 1 second, Sarah. Go ahead.
Hi, Governor. Thank you for letting us ask questions at this time. I know you're doing a lot of work for the state. My question to you is twofold. One, can you give us a sense of where we are now? Are we starting to see a surge again as the numbers did start to come down of those contracting the virus, the rate of the folks contracting the virus? And also, if you could speak to exactly when you think that the field hospital will need to be put in use, or if it will start right away.
I'm going to ask the Brigadier General to answer that question. Could you just tell us what the plans are for standing up?
So we actually have planners. You can see them in our background. They're actually doing their work already, and we'll be ready tomorrow to start moving equipment into here, and it will take just a few days before we're ready to see the first patients.
General Cherry, one more question. So the room we're in is going to be the field hospital?
Correct. You will see that transform over the next week from this amazing facility that's here now into a world-class hospital.
All of the
All, yes, with bed stations, all of that, yes.
And we're going to leave part of the hospital for the Patriots next time they come.
Do we have another question?
All right, next question for Kevin Schofield, SEC Insight.
Thank you. This is for the governor and for King County Executive. Can you give us some more specific numbers on the percentage of hospital beds, ICU beds that are now full today in King County and Washington State, so we have a sense of how close we are to meeting the surge capacity?
Do you want to try that in?
I would have to, thanks for the question. The question is, can I give you the exact percentage of the beds at hospitals that are full now? We're getting anecdotal reports of hospitals that are seeing considerably higher than normal admissions, but not a system-wide overwhelming yet. I'm not able to give you exact numbers. We'd have to have our public health folks provide those to you. I will say that it's very concerning because the hospitals often operate at fairly high capacity already. So there are going to be folks who previously would have been in the hospital with other conditions who will need to be discharged to facilities outside of hospital, whether it's in a fully equipped medical center like this or in one of our centers that we're standing up around the county. We will get you those numbers, but even, the issue is this. We have the imperative of driving down that rate of infection. And to the previous question, over the last many days, whether there are many tests or fewer tests, the rate of positives has hovered right around 7% the whole time. I'd be very concerned if I saw the rate of infection within any sample of those tests suddenly jump up. We are not seeing that. That gives me some tentative confidence that the measures that the governor's put in place that our population has embraced, that those measures are working. But second, we have to keep pushing to create this capacity that allows people to not have to be in the hospital, because those hospital beds for acute care are a critical, limited resource, and even more limited, the ventilators that people need if they have a very serious case.
Next question is for Erica Barnett.
Hi, Governor Inslee. You mentioned a couple times that prison labor is going to be used to manufacture hospital gowns, and I was wondering if you could talk a little more about which prisons, how much prison labor, and whether the prisoners will be paid.
I will have to give you, the question is about the prisoners who are making the hospital gowns. I really don't have the specifics on any of those. I will get to that to you as fast as I can. I will comment that I'm told that the prisoners are very eager for this job, and we're eager for their success in this regard. By the way, I want to comment on the health issues in our prisons. We, of course, have a commitment to reducing to the extent humanly possible the risk of infection in our prison system. I've had at least 2 briefings in the last week about this issue, and I can tell folks that there is about as good of a screening system to keep COVID out of our prison system of anywhere in the United States probably, and there is a plan to, in a sense, isolate prisoners within the facility in the event that the COVID gets into any of our facilities. We take this very seriously, and we're going to look forward to keeping these incarcerated individuals as safe as humanly possible.
Last question will go back to Deborah Wong if you're there.
Deborah?
Deborah, may I take it?
Sure, we'll take another Deborah. We got another Deborah here filling in. We got a substitute.
I'm sorry. So I did want to ask the general another question, and that is, and maybe all of you can answer this. So I saw someone break his wrist last week outside of my place. I don't live that far from here. Is that the kind of person who would come here, or who would end up here? Do you know? Someone who's in the hospital now but won't have COVID-19 and needs a little more care. Someone who's just hurt suddenly needs care. Who will come here?
Yes, so I'll probably actually have to turn the details of that question over to someone else. All of those are the types of patients we can handle, but who comes here will be a policy issue that we won't make. So I'm not sure who can answer. Can you answer that, sir? Ma'am? Thank you.
Yeah. So this hospital is going to be a full working hospital, and it's going to have everything from pharmacists to surgeons and the like. It is for non-COVID patients. Chief Scoggins has been working with our hospital system here to make sure that at the state level and the county level this is fully integrated with our systems. We know that many of our hospitals right now are getting overtaxed by COVID, and we know that's going to be worse. We want to make sure that we can offload those patients to a hospital setting that is going to be safe and efficient for them. And so the goal of this hospital is to stand up that capacity. Those people will be transported like most people are, either by ambulance or fire medic. But it will be in consultation at the outset. I have to, again, I want to say the World Health Organization issued a report and said the most important thing that governments can do in communicating to the public is to speak with one voice and be clear. And I couldn't be more grateful as mayor of Seattle to be standing here with the people I am today. The governor, the county executive, our Congress delegation, and the others who I've known them all for a long time. We're friends. We have had impassioned discussions because these are hard and uncharted decisions we've had to make. But I could not be more proud that from every firefighter and every frontline hospital worker to the people standing here today, that we are speaking with one voice for the public to know that there is going to be true leadership. And our goal is to make sure that we protect the lives of everyone in Seattle, in the region, in Washington state. And we can only do that if we build for the future. So this hospital means that we know in the future shortly we're going to need that capacity. And we can't wait until we're in the middle of the emergency to do it. So again, I just really want to thank the governor for your leadership, Congresswoman Jayapal for yours, Congressman Schreier for yours, and Dal Constantine, who's been just a tremendous partner. But mostly I also want to say the numbers we see every day, it's starting to just be a tally. It's not. It is real human lives that are impacted. Every one of those people sick and every one of those people who die are families that are struggling, that are hurt. And almost many of them reflect the work of our frontline hospital workers who are tired and exhausted, who had to fight to have basic personal protection equipment. And I'm proud that the people here today from the federal government, FEMA, the Army, our congressional delegation, are showing that as a nation we will stand together, as a region we will stand together, and as a city we will stand together. Stay home, wash your hands, don't touch your face, and please keep the physical distance but stay connected socially. Thank you for that, Congresswoman.
One more comment.
Yep.
I just want to make a closing comment. I want to ask Washingtonians to do something, which is to take a little picture out of the newspaper of a nurse and tape it on your dashboard. And before you start your car, look at that nurse and say, do I really want to put this person at risk? And it's those type of decisions that are going to save a lot of lives so we can get the 627th home as soon as we can. Thanks to everybody. Take care. Yeah.
Driving. You mentioned a lot of cars on the freeway today. We've heard a lot about people driving across the state. Can you please tell Washingtonians what they should or should not do regarding driving?
The question is what I should tell Washingtonians. Well, what I have told Washingtonians is a legal order of the state of Washington. Stay home. Stay home. Unless you have an essential business that requires you not to be in your home. Now, one of those things is to take a walk on occasion around the block. Good to go. One of those things to go to the grocery store. But driving all across the state to take a vacation with your grandkids and wrestle in the dirt with them and infect your grandparents and everybody else around you is not acceptable. Businesses that are not essential cannot be open now, and one way or another are going to close. So that's my admonition and request. Let's go win one for Russell Wilson. Thanks a lot. Take care.
Thank you, everyone. Thank you guys for being here.
First time.
Gov's going to huddle up with a couple of the electeds on the other side of the stairs.
Meet the governor on the stairs. My